Hey guys, good morning. Dr. Greeney here. It's been far too long, so real happy to have you guys today. Looking forward to answering your questions. Wrinkly neck, I would say look for, you could either have Botox done in that area. Actually, they can inject the platysmal bands and improve that some, or some lasers can be done on the neck, but you have to be a little bit more careful because there's less oil glands and hair follicles there for your skin to heal. So that's a good option for you. Amy is a nurse and she's having some trouble with Maskne. So that's been a struggle over the last year for sure for everybody. Maskne is a super common problem, and the issue is you're getting a lot of irritation from the mask. So a lot of the acne treatments can be irritating too. So you want to balance using some of the irritating acne products to help the acne without over irritating your skin. So something I like to do is use something gentle like azelaic acid, or you could use a gentle salicylic acid cleanser like the one from Vichy, and do that. And then before you go into work, if you'd like to, and if you feel like you're getting irritation and rubbing, what I would recommend that you do is actually apply some like La Roche-Posay Cicaplast balm as a protective barrier. But you got to use those actives like azelaic acid. That's a little antibacterial. It's going to help fight that acne off, or the cell acid, which is actually going to break open those pores, prevent them from getting blocked. Fungal infection treatment for the whole body, that's when you got to see a dermatologist for. You're going to need oral medication, and those medications come with risks. So you'd have to talk with somebody in person. What's the reason for scalp burning? So burning scalp can have a lot of different reasons for that. You want to definitely minimize your irritants and allergens. So use products like Vanicream, like the Free and Clear shampoo, and then see your dermatologist, because there can be some complicated things that cause scalp burning. Safe to use niacinamide and vitamin C together. Yes, I've converted on this. I used to say don't do it, but it seems the general consensus now is it's fine to do. Vitamin C is kind of a wimpy molecule, and it's prone to basically chemical reactions that inactivate it or cause irritation. So I would say go ahead and do that. Red veins on your cheeks, you don't want to have those injected like we do on the legs. You're actually going to want to get a cosmetic laser called pulse dye laser. That's a good option for you. What good lightening skin for ACANTHOSIS nigricans? A real common problem. ACANTHOSIS nigricans is what we describe as hyperpigmented or dark brown or black velvety plaques that you can feel usually on the neck or under the arms. It's caused from thickened skin. So you can actually use gentle moisturizers with gentle acids in it like amlactin or ameliorate, and you can use those. I've done a few videos on this, including YouTube videos on this, if you want to get more information on it. Freckles, dark circles, and pimple marks, facing this problem for a long time. So you got a few things going on in pimple marks. So pimple marks, if you're using a retinoid at bedtime, that's something that's going to help probably lighten the freckles a little bit. It can help improve dark circles and also help pimple marks because it can help formulate collagen in the skin and help things in that regard. Been using adapalene is 3 months. I still have little breakouts. Is that normal? It's absolutely normal. At 3 months, you're going to start seeing good steady improvement. Just keep up with it. Make sure you're treating your whole face at least 5 nights a week. The best for red spots and dark spots, please. I am a huge fan of the product called Faded. It's by a company named Topicals. So you can look it up. I believe it's available in Sephora now too. So I would check that out. Other things that can help those is adapalene, using a great sunscreen every day. Any advice on fungal acne? For fungal acne, about one of the best things you can do is use something like a ketoconazole shampoo. There's a brand name called Nizoral shampoo. You can use that as a body wash, a face wash, and that can definitely help. Does vitamin C lend to getting more sunburn more easily? I've noticed a bit more sensitivity. Well, it certainly can irritate and cause some sensitivity, but it actually prevents your skin from getting a burn. In studies where they've done this, they've actually applied sunscreen along with vitamin C and given the same amount of UV light, and then looked at the skin and actually taken pictures of it. The people that use on the same arm, same person, if they have vitamin C on their skin, that, remember, this is an antioxidant, so it actually helps prevent damage to your skin. So actually they're less red, less burnt at the same dose of UV exposure. So it's one of the best things you can do in the summer. There's a myth online about not using vitamin C's in the summer, and that's completely false. Which do you apply first, sunscreen or moisturizer? You do moisturizer first, then your sunscreen. Eczema treatment for kids, Vaseline is the best thing you can do. Gentle skincare, Vanicream type products that remove allergens and irritants. Moisturize twice a day after you get out of the shower. Just had Fraxel yesterday. Can I use vitamin C on your face? I would not. I would just keep everything incredibly gentle. Just focus on moisturizing for now. Nothing more that's going to irritate. Don't go back on your tretinoin. Don't go on your vitamin C yet. Give it time. I can tell you, I had Fraxel recently too, and I had some hyperpigmentation from it. I did my best in putting sunscreen on. I am rehabbing now the hyperpigmentation with the products, like I said, like Faded. I'm back on my retinoid now, but for right now, just stay super moisturized, cleanse your skin gently every day, and go with that. Do you recommend eczema? Not really. Do you recommend putting vitamin E capsule around your eye? Is a good idea. I probably wouldn't do that. I would just use a formulated eye cream. I think that's a better way to go. These things are studied for that purpose. They're developed with probably millions of dollars to develop these products and market them, and they want them to be safe and effective for people. So I would just get a good eye cream. One of my favorite ones is Neocutis. It's quite expensive. If you want something incredibly gentle, you could look at something like the Vichy Mineral 89. What's the best way to achieve even skin tone for 40-year-olds? I'd say the best thing you can do, selective memory, I like the name, is you could actually start on adapalene at bedtime. La Roche-Posay makes a nice one, or you can use Differin, and that would be a real good way to start with that. It's going to help texture dark spots. It's going to help prevent acne. It's going to help wrinkles. Deep acne scars, what can help? You're going to need pretty aggressive treatments in the office probably. You're going to need lasers, maybe peels. There's certain things called TCA cross procedure. All of those things can help deep acne scars. Sometimes we'll even cut the acne scars out and suture them up to try to get a better result. We can laser over that to make it look even better. I just wanted to ask if hormonal acne gets better with ordinary niacinamide. I would temper your expectations. I think it's a fine thing to try, but oftentimes hormonal acne requires oral solutions. So you actually got to usually get oral antibiotics, birth control, isotretinoin or Accutane, which gets it's spooky online, but it's actually a great medicine that changes lives and cures acne permanently for a lot of people. How do I get rid of post-inflammatory hyperpigmentation from scar for sensitive skin? So I would try that Topicals Faded product. I think that's a really nice product for that to help remove hyperpigmentation. It's got like 5 hyperpigmentation fighting ingredients in it, and it's only $30, so the price point is incredible. What could help actinic keratosis? Well, sunscreen is going to prevent more of them from forming, but oftentimes you'd have to have that treated with your dermatologist. PDO threads, a nice option for people that don't want to avoid a facelift, but you got to remember they're temporary. And if you watch the videos on it, it's a little bit intense, but I think it's a pretty cool technology, and the idea of putting that suture material under the skin is basically going to stimulate some collagen formation, so probably give you some long-term results too. How can I help maintain my rosacea? The best thing you can do is use sunscreen every single day. If you get rosacea bumps, then I would use some azelaic acid for that. If you're getting redness, you can consider some niacinamide, and if redness is your problem, that's the hardest part of it to treat, then I would recommend using a laser therapy like PDL. I am 43. What can I do for large pores? So basically for pores, you got to remember they're normal. First of all, I got big pores on my nose, but what we can do is we can prevent them from looking worse by using sunscreen every single day, and we can make them appear smaller by making sure that basically the pores aren't getting blocked and plugged with keratin. So we can use things like keratolytics, like beta hydroxy acids, like salicylic acid, and we can use that. I actually got a few examples here. This is the Medicube Zero Pore Pad, and this is a really nice combination of beta hydroxy acid and some other botanicals that can help make the pores appear smaller. It's got like an embossed side on one side and a silky side on the other, and you can gently kind of exfoliate. It's not even really exfoliating, it's very gentle. Do that, and then use your adapalene at bedtime to try to make those appear smaller. There's nothing that really makes them go away completely. So the idea of this like glass skin that you see in magazines is just simply false. Underarm dark spot solutions, that amlactin, which is ammonium lactate, can help. Use it over a period of weeks to months to get improvement. Is AVENE sunscreen safe? As far as I know, it is. I actually need to look more at the whole benzene scandal with sunscreens. I don't know what that list contained, but yeah, you want to look for sunscreens SPF 30. If you're worried at all about absorption of sunscreen or that, then use a mineral-based sunscreen. Look for the active ingredients of zinc oxide and titanium dioxide. Melasma solution, please. Well, I'd probably be a millionaire if I had a 100% solution for melasma. It's very hard to treat. I will say gentle superficial chemical peels can be very helpful for melasma, but they have to be done by an expert. You can't have anybody do it because you can risk having terrible side effects. Peels can help. There's prescription Triluma, which is a really nice treatment for it, but if you're not using a great sunscreen every single day, that is absolutely the #1 thing that you have to do. SPF on top of makeup, no, you can do it under your makeup. In my funny Ariana Grande video, I put it on over makeup, and all the women on here went nuts, and the whole video was a joke, you know. If you haven't seen it, it's the one that all you see is some blue sleeves if you want to watch it. It's got some laughs out of people. What's the best sunscreen for sensitive skin? So I'll tell you what, sensitive skin brands, Vanicream has been like the hero for a long time. So, you know, Vanicream now makes a sunscreen too. Foot fungus under the nail, my son has it and I don't want to get it. So foot fungus is really tough when the nails are involved. Even with the best treatments, you know, we maybe cure this 30% of the time with a high reoccurrence rate of it coming back, unfortunately. Some of the things that can help, it's all prescription stuff pretty much. There are some lasers that have been approved for fungus, and there's some lights being studied for fungus as well. Some lights that you can kind of put on your toe to kind of kill the fungus too. But I would see your dermatologist, you know, for a kiddo, you know, doing something topically. There's a pin lac, which is a solution you put on the nail. But a toenail is going to take a year to grow out, so you got to treat it for a really long time to see the improvement. And even if we treat it with oral therapy, a toenail we got to treat for 3 months, you know, so it's very long. What can I do for cystic acne and large pores? So Angel, the best thing for cystic acne, you're going to have to usually get some type of treatment with isotretinoin. You know, maybe, you know, if you're a lady, birth control can help some people, spironolactone can help some people, but you got to talk to your dermatologist about that because there are risks. Collagen for you says, what does that do? Well, glutathione, kojic acid, and that are things that help lighten skin pigment. So this helps skin lightening, and usually with some of these mild things, you get a little bit of a glow from it. So it's an idea for brightening and lightening. Cholesterol deposits, how do you get rid of those? You could see a cosmetic dermatologist and they can gently zap them away. Do dry skin shedding like dust with hypothyroidism. So yeah, it sounds like you're super dry, and definitely skin dryness, or what we call xerosis, is really common with hypothyroidism. Yeah, so I would recommend using a great ointment-based moisturizer after you get out of the shower. You're just barely pat dry your skin, a little bit damp still, and go ahead and apply Vaseline. Is it normal for HA to burn? You know, it may burn a little bit, but it's not really like an acid in the sense it's going to irritate you. So especially if you put it on, it's super transient. I mean, most of mine don't burn, but I guess it could. How could I lighten dark knees for tan skin? I would recommend using amlactin, and you can use that on the armpits as well. I would like to know about consuming collagen. Does it really work, and what's the best collagen? So I have only tried one oral collagen, and that was a Khloe Kardashian collab. But basically, there's not enough research to support that oral collagen helps to skin. So I wouldn't really worry about that or spend your money on it. I would focus on good skincare, sunscreen, and that. Any advice for someone stuck between the PA and MD route? I was, you know, when I was trying to decide, I actually was thinking about the same thing. Do I be a mid-level, or do I be a full-fledged doctor? And at the time, I was working with a really great surgeon named Dr. Bentley. I was in Iraq at the time and working in a combat support hospital. He's like, go all the way, like go become a doctor. I will say it's not for the faint of heart. You certainly can't think about, oh my God, this is going to take me 13 years to do it. You literally have to take it a day at a time to get through the process, because it is a lot. It's a lot of work, and you do give up a lot. But I am happy I made the decision I did. I would certainly never take it back. But to go back and think about redoing everything again, that would be a really tough pill to swallow. I really appreciate all of you guys. Thank you. You know, recently passed over 300,000 followers on TikTok. Love helping you guys. Almost to 25,000 on Instagram, and just over 2,000 on YouTube. So thank you guys so much. I appreciate it. I hope you guys have a great day.